everybody, and welcome to another Move with Ease. Sorry for the late start, technical difficulties, as always. So what we're going to look at over these next 15 minutes are 3 techniques for nerve flossing. So nerve flossing or neural flossing. So I'll just talk a little bit about what nerve/neural flossing is. So what it essentially is sometimes we can get kind of neural pain, for example, in the side of the neck, coming down the arm into maybe the thumb and the first finger. And this is associated with the scalene muscles, so muscles that sit either side of the neck. And you have this interscalene triangle you've got 3 scalene muscles. It's the first and the second anterior mid-scalene muscles and the first rib that form this triangle. And the thoracic outlet nerve, or nerves, it's like a bundle, comes through that triangle. And if those scalenes are compressed, you get this neural pain. So the technique of nerve flossing is to essentially release the compression and put a soft, gentle stretch on the nerve, and then there's a release. That soft, gentle stretch of the nerve is then repeated with that release. So we're going to look at 3 techniques, one for the scalenes, one for sciatic-like symptoms. One method is focusing on the lower back, and another method is focusing on the piriformis muscle, that is a butt muscle attaching the pelvis to the thigh. And when the piriformis becomes compressed, it can cause sciatic-like pain running in the bottom, down the back of the leg, maybe all the way to the ankle and the foot. So let's crack on with these 3 techniques. So neck neural pain that comes from the side of the neck, maybe radiating down the arm to the back of the hand, maybe coming into the thumb and the first finger, is a sign that the scalene muscles are contracted. So the technique for nerve flossing for the scalenes, there are many, but this is just one of them. What I want you to do is just raise your arms. They don't have to be at this horizontal level. If the here is more comfortable, maybe one slightly higher than the other, then do that. So just find your comfortable position, knowing that throughout this technique you can obviously rest, but you could lower, you could raise the arms and play around with what seems to benefit you most. So I'm going to turn one palm up, and you're always going to be thinking of the palm really that's facing down. And you're going to turn your head to look at the palm that's facing down. Then you're going to switch palms. So the palm that was facing down is now facing up. The palm that was facing up is now facing down. And you turn to look at the back of the hand. Turning to look at the back of the hand. Turn to look at the back of the hand. So your focus is always thinking back of the hand. Now, we can add on a little bit more. Firstly, by looking further around to the side. And also, the palm that's looking down, you can actually think about leading with the thumb, bring the thumb down and around. So, thumb comes down and around. Sorry, my other hand wanted to join in. There we go. I got it. So especially if you've got those symptoms of thoracic outlet syndrome, then you may well feel the benefit. Now, never go into pain. Only do as much as you want to. Don't fatigue the neck muscles and the shoulder muscles as you do this. So I can feel that my arms are getting a little tired now. So probably consider that that's enough time to stop. Lovely. So if you have those symptoms of thoracic outlet, that's one thing that you can try. Now, if you've got maybe tight lower back and sciatic-like pain that may be coming from the lower back, here's a neural nerve floss for you. So I'm going to scoot back on my chair and turn around so that you can see. So you really need to have enough space. So you can see I've got like a stand on this chair. But you're going to need to bring the leg underneath the chair seat. So just kind of make sure you can kind of do that without hurting yourself. So what I want you to do, if we do the same side leg, is just place the feet firmly on the floor. Have an upward lift from the crown of the head so the spine feels nice and centered. And with the right leg, you're going to straighten through the right leg. Bring the toes towards the shin and look up. Then you're going to look forwards, bring the leg heel towards the bottom under your chair seat, point through the top of the foot, chin to chest. Leg lengthens, toes to shin, look up. The lower back might close, only go as far as you want to, so never move into pain. And then you bend the knee, bringing the heel towards the bottom, chin towards the chest, and the lower back will open, so the spine becomes into a flex position. Spine moves into extended position. Spine moves into a flex position. So just do this nice and slowly, enjoying the relief that this gives you. And if you don't have that sciatic-like pain, then actually I don't have sciatic-like pain, but this is really enjoyable. It mobilises the spine, stretches the body. Remember to do that to the other side. So we'll just maybe do 5 to the other side. So with the left leg, lengthen the leg, press the heel away, look up, lower back will close. Bring the heel towards the bottom, round through the lower back, chin to chest. Toes to shin, leg lengthens, open the throat, lower back or the spine extends. Heel towards bottom, point through top of the foot, lower back, spine open, so it comes into a flex position, chin to chest. So this is number 3. You go at your speed. 4. My breathing, I'm finding that I'm breathing out in this flex rounded position, breathing in as I lift my heart up, looking up towards the sky. So, worth trying. So let me scoot a little forwards. So the last one I'm going to show you is a nerve floss, a neural stretch, thinking of the piriformis muscle. Piriformis muscle attaches sacrum to the femur, the thigh bone. When that becomes contracted, it can press on the sciatic nerve, giving you those symptoms of pain in the bottom, referred pain down the back of the leg, the back of the lower leg, maybe even into the foot. And this can happen for the real simple reason of not moving enough and being seated for a long time. So you're going to have to come to lying on the floor. So I'm just going to get my chair out of the way. And I'm hoping you can see me. Like I said, I had technical difficulties at the beginning. So you're going to be lying on the floor, both legs are extended. You're going to bring the right knee in towards the belly. Take hold, right hand to right top of shin. And if you can reach the right foot with the left hand, then do. And if you can't, left hand just towards the lower shin. So whatever suits, whatever you can reach, and you're going to draw the right leg towards the left shoulder. So for some of you it might be a really small movement, others a little bolder, but the back of the head stays on the floor, the shoulders stay grounded and heavy. You're essentially bringing that right knee towards the left shoulder. For about 5 seconds, release, right foot to the floor or the right leg along. Left knee comes in. You bring the left hand to the top of the shin bone, right hand towards the ankle, or if you can, inside of foot or outside of foot. Just encourage the left leg over towards the right side. The hips and the bottom stay grounded. 5 seconds, release. So let's do that to the right side. Draw it over. 5, 4, 3, 2, 1. Lengthen the leg. Left leg, knee into chest. Draw that leg over. 5, 4, 3, 2, 1. We'll do one more to each side. So you always just need to consider how many of these you want to do, whether it's a number or whether you want to do it for a duration of time. Never aggravate your symptoms. This is all about relieving your symptoms. So for me, I don't have any sciatic-like pain, but that still gave me a really lovely stretch towards, stretch of the glutes. So I hope you found those of benefit. I definitely know that the neural floss for the sciatic nerve, the second one that we did, is on my YouTube channel. And I could actually put the others 2 up. I might well do that in the very near future. But I hope you found those of benefit. If you have any questions about them, then please always contact me to ask. And I'm always interested to hear, for those of you especially that have that pain down that arm or the pain, the sciatic-like pain, lower back, glutes and leg, that if you've got those pain symptoms and you practice these, are they of benefit to you or are they not? So it's been lovely. I've loved, again, teaching you all. And if you're replaying this, I hope you enjoy the practice and that you've learned something from Move with Ease today. Take care, everyone. Bye-bye.